Hi, my name is Daphine Postl, and today I'll be presenting about deaf women's contraceptive practices. This is the research team whom have also been working on this research project. First, let's start out with what contraceptives are. They're anything used, taken, or done to prevent pregnancy. Another word is birth control. In what context am I using accessibility in for this presentation? Do I have access to information? Like, do I know what my options are and what types of birth control are out there? Language. Are there communication barriers, or can I efficiently communicate what my options are? Financial. Can I afford to pay for birth control? Can I afford to go to the doctor and get a prescription? Lastly, physical ability. Can I actually go to the doctor and go to the pharmacy to get my birth control? These four I just mentioned are possible reasons why nearly half of all pregnancies are unintended every year in the USA. Now, keep that statistic I just mentioned in the previous slide in your head. Deaf women face barriers to accessing and learning about health topics. A possible reason why is because there's not a qualified interpreter or the doctor is not accommodating. Because of that, deaf women are 67% more likely to experience unintended pregnancy compared to hearing people. Now, this is an issue because it can possibly cause negative health consequences. Consequences like delay in or lack of prenatal care, maternal postpartum depression, intimate partner violence during pregnancy, and lastly, a lack of breastfeeding. Last year, I presented about deaf people's experience with COVID-19. One of the results we found is that deaf people are more likely to use preventative strategies like washing hands or cleaning surfaces. So, I was curious, are deaf women more likely to use preventative strategies for pregnancy too? So, my research question: how do deaf women understand, use, and access birth control? We have two aims for this study. Better understand current needs and barriers of deaf women in accessing reproductive health care. Aim 2, gain insight into the deaf woman's experience navigating reproductive health care. I also want to mention that this is the first project to collect national information on reproductive health in deaf women. So, our population, who did we study? At the moment, we have about 145 responses, ages ranging from 18 to 71. The requirement to participate is that you must have a uterus. Out of those people we sampled, 89% identified as women and 13% identified as being a member of the BIPOC community. Roughly 50% of deaf participated, 40% hearing, and 10% hard of hearing. And data collection is still in process right now, so we're not finished. So, how did we recruit our participants? We recruited through various social media platforms like Reddit, Facebook, and we also posted flyers on RIT's campus. We asked participants many different questions, but for right now, I'll be focusing on 3 of them. Number 1, do you use birth control at the moment? Number 2, what form of birth control do you use at the moment? And number 3, if you had a preferred method you wanted to use but couldn't, why is that? Just a reminder, these are the preliminary results. We're still in the process of collecting data, so this is what we have right now. We found no significant difference between deaf and hearing use of birth control. They're very similar. We asked what their main method of birth control is. You can see the stars are labeling what similar types of birth control both population uses. So like both use birth control pills or IUD, for example. So you can see some are different, some are similar, but there's nothing significant at the moment. What's the reason you did not get to use the birth control method you were interested in initially? I was interested to find that deaf people reported more that they did not know why they couldn't access that type of birth control. You can see that hearing people didn't report that as much. I also noticed that hearing people reported more that they did not have as much money. Something important to note is that one of the reasons why deaf people did not get the birth control that they wanted was because they became pregnant. Maybe that's related to the statistic I mentioned before that deaf women are 67% more likely to experience an unintended pregnancy. To summarize, the preliminary results that we have at the moment do not show much variance between the deaf and hearing individuals, nothing significant. We are going to continue to collect data and also focus more on getting data from minority populations, since it is not representative of the national population. Our future directions and goals. We want to increase and spread awareness of deaf reproductive experiences. We also need to improve access to reproductive health information. What are some possibilities of why deaf women experience more unintended pregnancies compared to hearing people? We found a survey that studied the most commonly used methods of contraception between deaf and hearing groups. Within the deaf community, 45% reported using withdrawal, 34% condoms, and third, oral contraceptives at 17%. Within the hearing population, 70% reported using condoms, and second, oral contraceptives. So how effective are these birth control methods actually? Condoms are 85% effective at preventing pregnancy. Oral contraceptives are 91% effective. Lastly, withdrawal is lower at 78% effective. What are some possible reasons why there is more misinformation within the deaf population? Most fully immersive and fluent conversations that deaf people are involved in are with other deaf people. A reason for this is because of communication barriers. Children acquire information various ways, two of which being horizontal learning and vertical learning. Horizontal learning is the peer-to-peer transmission of information, two kids communicating what they know. We find that's more common within deaf groups. Vertical learning is learning information through parent to child or teacher to child. We find that hearing youth get more of the information from vertical learning. So how does horizontal and vertical learning relate to the medical field? Think back to a time when you were a kid and going to school and you learned something, anything, from the kids around you that in reality was false information. Later you may have went home and told your parents what you learned that day and they were like, no, that's not true. Or later you're in school learning about that same topic and realize, oh, that was false information. The correct information was learned from parents and teachers. Deaf kids go to the doctor with their parents or to their own medical appointments, and they don't have that incidental learning to acquire the correct information. They might have those same beliefs then continue throughout their life. Now you can see that this research on deaf women's reproductive health is very important. So I just want to say thank you to the RIT NTID Research Center on Culture and Language for making this research possible. Again, thank you for your time and thank you for watching.